Good afternoon, and thank you for listening again today. As of 2 p.m. today, there have been 2,291 positive cases of the COVID-19, including 24 deaths. Approximately 25,000 Missourians have been tested. As I have said every day, we are constantly monitoring and reevaluating the situation here in Missouri, and we will continue to exhaust all options to contain, control, and fight COVID-19. Medical professionals and first responders across the state are working tirelessly to meet the rising challenges posed by COVID-19. But we know additional medical professionals are in high need. To help with this, DHSS, SEMA, the Missouri Department of Economic Development's Missouri One Start Division are teaming up to recruit medical professionals not currently part of the workforce to join the Missouri Disaster Medical Assistance Team. This is a specialized state team that responds to critical health emergencies and deploys when necessary to provide patients with on-site medical care. We are calling all available medical professionals to join this team and support the fight against COVID-19 by providing care in high-need areas. Your efforts can help and save the lives of fellow Missourians. Today, Director Karsten is with us today to give us an update from SEMA and the Department of Public Safety. Director.
Thank you, Governor, and good afternoon, everyone. First, I want to let everyone know that Missouri's medical professionals are already responding in very large numbers for the Governor's call this morning for additional help to the COVID-19 response. They are responding in such strong numbers that they're encountering delays in our online volunteer system. We have IT personnel working to correct the situation so the website can handle the volume that we're experiencing. We expect that to be completed this evening. For now, you're experiencing problems on the site. I would ask that you close your browser window completely and go back to it in an hour or so. Refreshing or having the browser window open only puts more demand on our system. So this evening, we invite medical personnel interested in volunteering to go to our Department of Public Safety website. That is dps.mo.gov. You'll see a prominent graphic that reads, Recruiting Medical Personnel in Response to COVID-19. Click on that and it will take you to a description of the program and a link to register. I want to say a special thank you to Missouri's medical professionals for responding, and thank you for the patience as we work through the technical difficulties of your tremendous response. Thank you. DPS, SEMA, the Department of Health and Senior Services, and the Department of Economic Development teamed up to expand the call for volunteers because we know how important and how effective the Missouri Disaster Medical Assistance Team is. We call it MO-DMAT 1. DMAT volunteers have already assisted 2 hospitals in the state who needed additional support because of the toll the coronavirus has taken on their personnel. Last month, when a patient of the Golden Valley Hospital in Clinton, Missouri, tested positive for COVID-19, there was a concern the disease could spread to the staff. Many staffers at the small hospital were quarantined, and additional staffing was needed. Golden Valley reached out to our DMAT team, and DMAT was able to staff the hospital with 3 medics, a registered nurse, and a medical doctor. They joined the permanent staff for 5 days at the hospital, providing a critical bridge between the staff and those impacted by COVID-19. That was March 18th through March 22nd. Then, the DMAT medical personnel just yesterday completed a similar mission at another hospital where the permanent staff had been exposed to the coronavirus. In that case, the DMAT team consisted of 2 critical care nurses, a medic, and they helped permanent staff for a total of 6 days. This is the kind of vitally needed assistance DMAT can provide, and we welcome the wide range of medical skills from the professionals who are volunteering now to assist. Another medical response effort that SEMA has is called Show Me Response. In March, that medical group registered 362 new volunteers, which is up by a factor of 10 compared to the average month. As Governor Parson has said, this is a war that we're waging against the coronavirus. In a war, you need well-skilled and reliable personnel. We have them in Missouri. We just need to mobilize more. That's what this initiative allows us to do, and we're inspired by the overwhelming response we're seeing from Missourians. In a war, you also need logistical capabilities. We're mobilizing and moving shipments of PPE and vital resources the same day that it arrives. But right now, our biggest obstacle is a slow delivery of PPE that we've ordered. Since this began, we've ordered over $42 million worth of PPE. For example, we've ordered 4.3 million N95 masks last month. To date, only 25,000 of them have arrived. Our vendors assure us they're continuing to expedite our orders, but the supply chain is slow for everyone across the nation. So we're doing whatever we can in the meantime. Yesterday, SEMA worked with FedEx to expedite getting an additional 95,000 surgical masks through customs in another state and get them into Missouri to help protect people from the coronavirus. We're expecting more PPE and hand sanitizer for our first responders next week. In a war, you also need the support of the citizenry, and that's exactly what we're seeing. We at the Department of Public Safety, as well as the rest of state government, urge everyone to continue practicing social distancing. The more effectively we all do that, the more quickly we can win the war against the coronavirus. I'm encouraged because across Missouri, we're seeing people who are positive with their efforts. They're keeping their distance. They're friendly and they're courteous. We also get questions about social distancing and how the local restrictions may vary, but people want to comply. That's what's best for their families and everyone in Missouri. And together, we will get through this. Thank you.
Sandy, thank you very much for the update. One thing I might just say in reference to the volunteers that we're looking for to help with these teams, I know some of you, maybe this has been retired or maybe is no longer in that profession, but maybe wanting to help. Doesn't necessarily have to mean you got to be on the front line fighting the COVID-19 virus. There's plenty of other things we could use support in to maybe free up those other people that are working the front line to be able to even give them opportunity to get a little time and a little rest to be able to fight COVID-19. So thank you again, Sandy, for what you're doing on that. In addition to the capacity of our healthcare system, we also continue to closely monitor Missouri's supply chain. I want to assure you, Missouri's food supply remains strong. Agriculture plays a vital role in taking care of our most basic needs during public health emergencies. And the Missouri Department of Agriculture continues to work closely with its partners to maintain our strong food supply chain. Today, Director Chin is here with us to give us an update from the Department of Agriculture. Director?
Thank you, Governor. The COVID-19 outbreak has definitely changed the daily life of every Missourian. Some of us are making fewer trips to the grocery store. For some, it means more conference calls and video calls. For others, it means longer and more demanding shifts if you're in healthcare. Although it has changed our daily routines, the one thing that it has not changed is the strength of our local communities. We are strong and resilient, and we take care of each other when times get tough. It's proven how thankful that we all need to be for our face-to-face conversations, eating out with our family, or simply going to the grocery store and having abundant choices. We've traded all of those for teleworking, for restaurant pickup, and taped lines on the grocery store to mark 6-foot guides for us. If you look closely, COVID-19 has actually brought out some of the best in our towns, both in rural and urban areas. It reminds us who we are as Missourians. We're people who show up and we get the job done. Just 10 days ago, I was here with Governor Parson updating you on the strength of our food supply. We have seen tremendous leadership from Governor Parson as well as U.S. Secretary of Agriculture Sonny Perdue. It's very clear the important role that Missouri agriculture will play during this COVID-19 outbreak. I'm happy to report that agriculture from farm to fork is catching up with the unprecedented food demand. As I said last week, this is not a supply issue. It's simply a demand issue. Our distribution networks made really quick adjustments as the demand for products that were used at schools and restaurants decreased sharply almost overnight. All the while, the demand for the supplies increased in our grocery stores. We continue to make adjustments and get better every day. Our food supply remains strong. At my local grocery store, we're starting to see the shelves fill back up. They're catching up to that demand. Our agriculture workforce is critical during this time, from our farmers and ranchers to the frontline grocery store workers. We know that COVID-19 information has been in the overload at some times. It can be hard to see the good things that are actually happening around us during this time. Our team at the Missouri Department of Agriculture continues to work to assist every part of the food supply. We've seen a lot of positive stories, and I want to share a few of those with you today. If farming has one overwhelming purpose, it's to feed people. And the Missouri Farmers Care, which is an organization of food and agriculture organizations, they've launched a special fundraising campaign called the Drive to Feed Kids. Over the last 3 years, this drive has provided 6.5 million meals to kids in need. All the funds go directly to Feeding Missouri. Feeding Missouri is one of the 200 food banks that is a part of the Feeding America network. Feeding America projects a 30% increase in their expenses over the next 6 months. So what does that really mean? It's a $1.4 billion shortfall in resources for our food banks over the next 6 months. So if you feel strongly about learning more about this, please go to MissouriFarmersCare.com/drive to learn more and to be able to donate if you're able to. A primary demand for fluid milk is the school lunch program. On behalf of dairy farmers all across the United States, Midwest Dairy is donating coolers to school districts across our state to safely deliver and keep milk cold. This will soon be extended to our local food banks across the state as well. Many restaurants are taking care of the hardest working people right now in healthcare and some of our most vulnerable children at the same time. They're also donating food to the food banks and to the food pantries in their communities. Our grocery stores are providing team member bonuses, and they're working creatively to find unique opportunities to serve their local community. Many of our ethanol plants have shifted from producing fuel to hand sanitizer. Our protein companies are trying to make sure their workforce is protected, and they're screening their workers as they show up every day to ensure a healthy workforce. Our life science companies in the state have been providing medical supplies every opportunity that they can. And of course, all of these stories are fueled by the beef, pork, chicken, fruit, vegetables, grain, and dairy products that are raised by our Missouri farmers and ranchers. I want to say thank you to our farmers and ranchers for your hard work during such an uncertain time in agriculture. You've felt your commodity markets drop. You've also felt the results of those changes in the distribution networks. And we want to thank you for continuing to feed our state, our nation, and the world through these very difficult times. I also wanted to take the time to once again thank the men and women who are in healthcare. To all the doctors, the nurses, the administrative staff, the county health department leaders, and everyone else, we know that you're rising to the occasion, and our job in agriculture is to support you. We know that you're tired, and we're counting on you. So I want to promise you this. Missouri farmers and ranchers will continue to be there for you. All Missourians can count on our farmers and ranchers all across the state to make sure that we continue to have an abundant food supply, and you'll see the food in the grocery store shelves every day when you go. Thank you, Governor.
Chris, thank you. Thank you very much for that update. I am thankful for the optimism shared by our farmers, ranchers, and agriculture community during this time of uncertainty. There is a sense of normalcy returning to our farms in Missouri. Grass is coming up, sun is out, farmers are returning to their fields for spring planting. The crops we are planting now will be critical to feeding, fueling, and clothing the world soon. They keep Missouri moving forward. On the behalf of all Missourians, I want to thank everyone who contributes to agriculture. Many companies and organizations have stepped up to help during this time of need, including Sysco Foods. The global leader in food service, Sysco has been working closely with many stakeholders to assist the Missouri's food supply chain. Today, their president, Rob Kirkland with Sysco Foods, is here to give us an update from his company. Before I bring Rob up, I had a chance to visit with him in November and his company to see what things they were doing and what innovation they were doing to help many areas across the state, including places of poverty, to do the things they were going to do. Unfortunately, here we are today with COVID-19 at the forefront. And what does companies like his do in a time like that? I had the opportunity to talk to him before we come in here just a little bit. His company has done over $50,000 worth of donations and support for communities around his company areas and around the state of Missouri. I'm thankful to have leadership of companies like this, and he's just one example of so many good people are doing so many things right now to help one another out. And it's an honor to have him here today to talk about his company and what they're doing when it comes to the food supply of our state. Rob?
Well, Governor Parsons, thank you very much for the opportunity to be here today to speak. Good afternoon, everyone. My name is Robert Kirkland. I'm the president of Sysco St. Louis. The COVID-19 pandemic has impacted all of us in unprecedented ways. And as the global leader in food service, Sysco is uniquely positioned to help Missourians. As the crisis has unfolded, Sysco has been working closely with a variety of stakeholders to address both the added constraints on our food supply chain as well as increasing our work against food insecurities in our communities. In the restaurant community, we're working with our customers to set up delivery and takeout platforms that will help keep people working and providing the tools and the products to help others convert their restaurant dining rooms into mini-marts supplying food staples to their neighborhoods. We're also serving the most vulnerable in our community, from pop-up food pantries to meal prep and distribution sites for out-of-work restaurant and hospitality workers, to direct-to-consumer donations of product and perishables, just to name a few. On March 19th, we announced a goal to donate 2.5 million meals in a 4-week period as part of the pandemic response strategy. Today, I'm very happy to report we achieved that goal in half the time. Local to our region, we've partnered, Sysco St. Louis, with a number of support organizations such as Operation Food Search, the Circle of Concern, the Urban League, and Better Family Life in efforts to get many donated essentials in the hands of our neighbors in the most need. Most notably, we were honored to partner with the Urban League in providing groceries and essentials to more than 1,000 families this Thursday of this week. The collaborative efforts of volunteers, police officers, the Urban League staff, and our workers was nothing short of remarkable. It's a true testament to how the citizens of this great state come together during the most difficult of times. And we expect more significant additional donations as needed. So, Governor, on behalf of Sysco, I want to let you know and assure you and the citizens of this great state that you can count on Sysco to continue with these efforts. Thank you.
Thank you very much. Rob, thank you very much. Sometimes people always expect government to come in and do everything. It's not government's role to do everything. Sometimes we have those intentions where we expect them to meet all our demands, but it's people like companies like Sysco. It's about other CEOs around the state. It's about everyday people. It's about the clergy. It's about people volunteering across our state that should help in crisis like that. And that's how we will get through COVID-19, is by working together. All of us, the business sector, the private sector, the clergy, all of us working together in government playing our roles. But it's why it's so important to have people like Cisco in our state that's willing to step up in our times of need to help the everyday citizen that can't help themselves right now. So, Rob, again, thank you for what you and your company have done. I appreciate it. As all of you know, yesterday I issued a stay-at-home Missouri order for all Missourians beginning on Monday. Let me just say this about that order. I think a lot of the people, you had the Director of Agriculture in here, we had a CEO of Cisco Foods. Both of them have told you the food supply is strong. Our chain is strong in this state. Yes, we are going to limit the number of people who can go in these stores, not because of a shortage of food, not because you're not going to be able to obtain your groceries. We'll make sure that everybody gets fed. We'll make sure that you get your groceries. But the one thing we have to do is make sure that we keep people separated because of the coronavirus. That's what those orders were all about. And that's why people need to be patient. They need to understand they're going to have an opportunity to buy groceries. We're going to deliver groceries to them, and they're going to be able to do it online. Everybody's trying to work for that. But everybody's also trying to maintain the safety of fellow Missourians that are in the state. We know this is an extremely difficult time, but like I said, this is a time we must all make sacrifices. Being at home is the safest place you can be for yourself, your families, and your fellow Missourians. We will win this battle. We will win this battle, as the director said. This is a war, and we're going to win the battle today, but eventually we're going to win the war. But everyone, in order to win that war, must do their part. They must step up at a time of need, and they must make sacrifices for others. But I guarantee you Missouri is strong, and we'll be able to handle this, and we will be able to continue to fight this battle, and we will become better as we were in the future. We will become better in the future than we are today because we fought this battle and we won. So I want to thank everybody for today listening. Kelly, you have some questions?
I do. Thank you, Governor. The first question is from Rudy Keller, Columbia Tribune. Governor, how has the governor helped people with developmental disabilities in this crisis? Has he asked for additional federal authority to waive rules on their support?
I'm not sure on the federal authority to waive rules. I don't know. The legal team would know that answer. But the main thing we've been doing is trying to make sure we focus and maintain all the services we can to those people. They've been a priority of this administration since I started, and no difference when we're in a crisis. Those people are going to need the services they need, and we're going to ensure that they get the services they need.
Okay. The second question is from Madison, a University of Missouri student with the state government. The stay-at-home order allows non-essential businesses to apply for a waiver from the limitations on social gatherings. Many say this exemption could put people at risk for non-essential services. Yeah. Can you explain?
Yeah. Yesterday in the order, we talked about essential businesses and non-essential businesses. Non-essential businesses have to follow the first order that we had in the state of Missouri. You cannot have more than 10 people, and you have to be 6 feet apart. That order from day one has maintained. That is the base for any business out there. If they open that door, they got to maintain that. That would be in the rules or would be in the exceptions.
Okay. Jacqueline Driscoll from St. Louis Public Radio. Governor, who is going to be enforcing this order?
These orders will be enforced like they were originally. They'll be on the local levels. The health departments will have a civil action suit that they can bring against somebody that's in violation of this. On the state orders, that they would go through the courts, and they would go through the courts to get an injunction against the businesses that they may utilize to be able to see how they're going to handle that situation on the local levels. But I do think that local order will have to be done on the local levels.
Another question from Jacqueline. Do you think that your occupancy restrictions on essential businesses will create unintended consequences, like forcing workers at these locations to manage large lines of people outside the stores?
I think it's much better than having them spaced out outdoors than it ever is having them inside a building and they're bunched up. I don't think there's any doubt about that. We know from talking to the doctors we did earlier today, the infectious disease doctors, that basically recommend we need to be outside. Much better off than we need to be shut up inside, as long as you abide by the social distancing orders. I think one of the things that was important that they talked about today was this is not an airborne disease, and we need to really remember that this is not airborne. So don't be afraid to go out in your yards. Don't be afraid to go outside. Don't be afraid to go take a walk. Those are things that's good for all of us, and we're going to be For the people that have to stay at home, you're going to be there for a while, so you need to be able to make sure that you can get out from time to time and exercise and enjoy the outdoors at a time like this.
All right. Nicole Roberts from Jefferson City News Tribune. Do you at this time anticipate that any state employees will be offered early retirement because of the budgetary concerns?
You know, we haven't got to that point yet in the budgetary process. Look, there's going to be a lot of moving parts to the budget coming into 2021, preparing for that budget. Right now, I am just totally focused on getting through till June. We'll start preparing for that budget down the road to see what we might do. But the legislatures will have a role to play in that too. But needless to say, we're going to have to make some challenging times in the state of Missouri when it comes to the finances, when it comes to the economics of this state. And we're going to have to make some tough decisions. But we're going to have to make tough decisions like everybody else is out there. Every individual, every business right now are making tough decisions. The state's not immune from that. We're going to have to do the same thing. So we're just going to have to see what that comes as we get through the process.
Okay, and the last question for you, Governor. This is from Jessica Hart, KRCG 13. When it comes to social distancing, is the government using any type of technology or data to see if people are complying with your order?
Yeah, we do. Every day we look at data. We look at the MHH, Missouri Hospitals Associations, of how many people are admitted to hospitals, how many beds we have, how many ventilators we have. We look at traffic patterns across the state of Missouri to see who's moving, who's not, you know, and what those trends are. And I do want to say this for the state of Missouri. You know, we are seeing parts of the state do a better job than others. And you're seeing a lot, frankly, in the urban areas that are seeing a swing downward in that. Rural Missouri still needs a part to play and needs to do a little better job of staying at home and staying off the highways. But we track all that every day. It's so important to have real data in front of you, what's really happening out there when you make decisions in this state. It is vital that we get that information every day. So when we do make decisions that sometimes can be unpopular, but the point of it is we're trying to make it on facts, on things that we have that are real data. So yes, we monitor the traffic, we monitor the movement in the state every day. We try to figure out where people are, where the hot spots are, such as what we did at the order. We know that by doing some of the orders we did, we made a funnel effect and we pushed people into big stores. And all of a sudden, by hundreds, if not thousands of people going into stores, and we knew we had to do something about that. And we did.
All right, thank you, Governor. The next few questions will be for Dr. Williams. Dr. Williams, this question is also from Jessica Hart, KRCG 13. A few weeks ago, the president talked about having testing sites in Walmart and Target parking lots. I haven't seen this happen in Missouri. Is this still happening?
We are fortunate here in Missouri that we have 41 mobile testing sites, and we're going to talk about that a little bit more. So I'm not familiar with Walgreens doing that or Walmart, but we are using the testing to drive our policy. You just heard the governor say that we are driven by data and by science, and that helps us make policy decisions. And so we're incredibly thankful to the 41 testing sites in addition to all the clinicians. We've done 25,000 tests in Missouri. And that information, I want to thank all the patients who've been tested. I'm glad 90% of you have been negative. But I also want to thank all the clinicians. I was joined by many this morning on a Saturday morning. They took the time to talk to me. And then the governor and I talked with the infectious disease experts all across the state today. So I just want you to know that as you're doing that testing, and I've mentioned before, we do more testing than any state around us except for one, we use that data and those tests to help us make public policy decisions. And you saw one of those yesterday. And now we're looking at that testing for surge capacity. And that's helping us very much with that. So I'm not familiar with those two doing any robust testing, but we are doing robust testing, and especially in our mobile testing sites.
All right, Dr. Williams, this is from Jeff Bernthal, Nexstar. What is the current status of hospital room availability in Missouri, and how does that look for the future?
Thanks so much for the question. As we promised yesterday, working with our colleagues at the Missouri Hospital Association, we started putting online on our website, www.health.mo.gov/coronavirus, a daily report. So I can tell you as of this morning, there are 10,000 beds in our approximately 150 hospitals throughout Missouri. and about 3,500 are available. I can tell you how many ventilators. We have about 2,000 ventilators in Missouri, and this morning about 1,100 were available. And so that's incredibly important as we use our testing data and look at our admissions to look at surge capacity, especially in those communities that we have more cases, such as in the St. Louis area, in the Springfield area, and to that extent in Jackson County. And so I would commend you to go to that website. It's there every day, and greatly appreciate our colleagues at the Missouri Hospital Association for helping us with that.
All right, Dr. Williams, this is from Alyssa Nelson, MissouriNet. What is the realistic testing rate going forward?
Yeah, we just talked about it again. Thanks for the question. So right now we're doing about 2,500 tests a day through 11 labs in our state lab. I think that we'll continue to increase that somewhat. But I would point out one thing is that at some point, flu season, we're looked at our flu numbers this morning in talking with the infectious disease doctors, and they're falling precipitously, and we're very thankful for that. It's been kind of a tough flu season. We've had 2 or 3 strains going around. We usually see that go down about April 15th, but it's gone down early this year, and we're incredibly thankful for that. My point being is that as we get through flu season, there'll be some communities that make the conscious decision to say, well, if you've got a fever and a cough, it's probably not the flu, it may be COVID-19, and they may reduce their testing. And we respect that. But right now, we're incredibly appreciative for the testing we're getting and expect that to increase somewhat because it really does help us drive the decisions we make for policy. And we think it's educational, and we think it reassures people to know that information.
All right, another question, Dr. Williams, from Alyssa. Military bases and some nursing homes are not publicly reporting cases. Without that complete information, how does the public know the true scope of the virus in Missouri?
Well, again, with any emerging disease, we have to make new rules. And we had the foresight about 2 months ago to make COVID-19 a reportable disease within 24 hours. So if they're not reporting, we need to know that because it is mandated by law that we know within 24 hours. And as you know, we added an additional rule so that we get all that testing that comes directly to us, whether it be from labs or providers or from the health departments. They're certainly, if they want to have it reported to them too in the local counties, we certainly support that. But we provide that every day at 2 o'clock because, again, we think that giving one source of information people find very reassuring.
All right, one last question for you, Dr. Williams. This is from David Lieb, AP. It appears that coronavirus death count on Missouri's health department's website is lagging behind. On Friday, it still showed 19 deaths. The Johns Hopkins website showed 33 deaths in Missouri as of Saturday morning, and even that is behind by at least 1 because it doesn't include the coronavirus death announced by Cole County at 2:15 p.m. Friday. And today's health department figures don't rise significantly, at least 34 deaths. My question is, why does the official state count appear to be lagging behind other reputable independent sources such as the Johns Hopkins University site?
David, great question, and thank you for asking it. And the reason is when we made COVID-19 reportable, we did not make deaths reportable within 24 hours. We have now corrected that so that providers who have a death will be required to let us know that within 24 hours, which will align us with our counties and Johns Hopkins. So again, we think that's important information to know, that people want to know that. We lament all those deaths, but we want people to know that and in those communities. And so starting, I believe, tomorrow, that will be mandated as reported within 24 hours by the providers. Thank you for the question.
All right, thank you, Dr. Williams. All right, Director Karsten, we have one last question. This is actually from a constituent, John Stambaugh. Has anyone talked with the electric utilities about their process or procedures to keep power plant personnel and linemen protected from this virus outbreak? I've talked with people from major utilities in Missouri, and I am impressed with their forethought on scheduling of essential personnel. But what about electric co-ops and other major utility companies? If you want a serious situation to go from bad to worse quickly, lose electric power for several days.
Thank you for the question. Electricity is one of those things we all kind of take for granted when we flip a light switch on or when we plug our cell phones in to charge. In this situation, I just want to assure all of Missourians that the State Emergency Management Agency works with our electric co-ops across the state as well as our public utilities. And part of that work includes their continuity of operations. Part of those plans also include keeping the linemen safe, keeping them healthy so that they can respond in the case of emergency. And now, with social distancing, we are aware that the co-ops and the public utilities are practicing that with their crews. They're practicing that when they give work assignments as well as when they respond to outages across the state. So very good question. We feel very comfortable about the co-op's ability to respond to outages currently across the state. So thank you.
Thank you very much for listening in today. In closing today, about 30 days ago when this all started, the COVID-19 started in our state. Most people in this state have been at this for some time now, working every day, long hours on the front lines. Doctors, nurses, emergency personnel, law enforcement, firefighters, and the list goes on of people out there working every day to make sure all of us can do what it is we get to do every day. I think it's important that we all realize how fortunate some of us are to have good health, that we're still at home, we're still safe, and sometimes you need to understand how important it is to enjoy your family, to enjoy the time together, to enjoy really who Missourians are, what kind of strength we really have when it comes in times of need, when it comes in time of trouble. Because that brings out the best of us in this state, as you see some of the people who are here today and what they're doing for this state of Missouri. And there's people like that all over this state. And trust me, there's going to be more and more people every day stepping up, saying, what can I do? How can I help? And that's how we will conquer, and that is how we'll win this war. And I have no doubt about that, and we will continue to get stronger every day. God bless you, God bless the great state of Missouri, and God bless the United States of America. Thank you very much.